Good afternoon, everyone, and a warm welcome to our annual members meeting. My name is Martin Havenhand, and I'm the chairman of the Rotherham NHS Foundation Trust. It will not have passed you by that we're doing things differently this year in that we're holding this meeting online. Although it is a shame that we cannot welcome you into our trust in person, we know that you will appreciate the reasons for this. It is our utmost priority to keep you, our patients, and our colleagues safe. This session is an annual opportunity for us to take a look back over the last financial year and to present to you, our members, partners, and communities, a report of how we performed, our challenges, our highlights from the year gone by. Although we have celebrated some milestones over the last 18 months, I want to clearly state that we still have some important, focused work to do to bring this trust up to where we want it to be sustainable, financially secure, and safe and sound for those we care for. We do not underestimate this feat. We have some big challenges ahead, which we do not take lightly, and to which I know our board and colleagues are dedicated. During 2019-20, we implemented our ambitious operational plan, but our financial position deteriorated in the last quarter of the financial year, which is a significant concern. More details about this are to follow as part of this presentation to you. In line with the rest of the NHS, the annual winter pressures remained a considerable operational challenge for us in 2019-20. And they continue to do so for the season ahead. These challenges emphasise the need for all-year planning to ensure consistency and to safeguard quality at all times. This year, we have had the added challenge of COVID-19 to deal with, and I want to pay tribute to all of our colleagues in the hospital and in the community who have all done a magnificent job in caring for our patients. I also want to recognise all the public and voluntary services in Rotherham who have been and are continuing to collaborate in dealing with this awful pandemic. As a trust, quality remains our top priority. Patient safety, clinical effectiveness, and patient experience are at the heart of everything we do, as we continue to implement our quality improvement plan under our Safe and Sound campaign. In light of this, in October, we were pleased that the Care Quality Commission raised the rating of our urgent and emergency care centre following an unannounced re-inspection, and we still remain focused on our action plan to make more vital improvements. As a key partner in the Rotherham Place Plan, we work effectively with colleagues at the Clinical Commissioning Group, our local mental health trust, RDASH, and at Rotherham Metropolitan Borough Council on shared priorities. We are all working together in planning for the flu season and the winter ahead. Work also continues in developing the South Yorkshire and Bassetlaw integrated care system, particularly in response to the NHS long-term plan. Louise Barnett, our Chief Executive for 6 years, left the Trust in February to take on a new role in Shrewsbury and Telford. In collaboration with Barnsley Hospital NHS Foundation Trust, we were delighted to appoint Dr. Richard Jenkins as our interim Chief Executive in February 2020. He is combining his role here with his existing role as Chief Executive of Barnsley Hospital. Richard is a highly experienced NHS leader and a practicing clinician who will lead the Trust to the end of September 2021. Looking forward, our challenge remains to deliver our vision, to be an outstanding trust, delivering excellent healthcare at home, in our community and in hospital. Quality will continue to remain our priority, but we must resolve our financial challenge and ensure that we are sustainably delivering our financial plan. We are committed to playing our part in ensuring that the South Yorkshire and Bassetlaw integrated care system is a success. Since the end of last year, due to COVID-19 pandemic, NHS colleagues across the country have been coping incredibly with this unprecedented challenge. My colleagues this evening will share more details with you about our response to COVID-19, along with our plans for recovery while continuing to cope with the future challenge of the pandemic. The public response in supporting our colleagues through the Rotherham NHS superheroes has been humbling, and I thank you all sincerely for your donations and messages of support. Our colleagues at the Trust, working in the community and in the hospital, have been remarkable in the way that they have been caring for our patients. And as a board, we value them greatly, and we are so very, very proud of them. I will now quickly run you through the order of proceedings for this evening's session, and then I will hand you over to our Chief Executive, Dr. Richard Jenkins, who will remind you of our mission, vision, values and strategic objectives. He will then deliver a short introduction and summary of last year's performance. We will then show you a case study of one of our healthcare services, and that is going to be the maternity team, and they have made some significant progress in the way they deliver care for women and families in Rotherham. Our Chief Nurse, Angela Wood, will then speak to you about patient experience, our CQC outcomes, and high quality, safe and sound care. Then our Executive Medical Director, Dr. Callum Gardner, will present to you information about outcomes for our patients. You will then hear from George Briggs, our Chief Operating Officer, who will deliver information on our performance. Stephen Ned, Director of Workforce and Organisational Development, will then cover details about our colleagues, staffing levels, staff experience and recruitment. Michael Wright, our Deputy Chief Executive, will then talk to you about our performance in terms of governance. Stephen Hackett, our Interim Director of Finance, will then cover details about our financial position. We will then be taken through a summary of important work with our partners by the Deputy Chief Executive, Michael Wright. Our auditors, PricewaterhouseCoopers, will then deliver their response to the audit activities that they undertook in 2019-20. You'll then hear from our lead governor, Gavin Rimmer, who will present to you his summary of the work of our Council of Governors and a little about their plans going forward. And finally, with a look to the year ahead and our priorities for the future. We will then switch to a question and answer session where we will answer questions submitted by you in advance or during the meeting. I would now like to hand you over to our Chief Executive, Dr. Richard Jenkins.
Hi, my name is Richard Jenkins. I've been Interim Chief Executive of the Rotherham Foundation Trust since the 10th of February this year. And I have to say it's been a fantastic experience so far. It's been great to meet such a group of really dedicated staff and to see the extra mile that people have gone through to deliver services to local people. It's been an interesting time to join an organisation because of the pandemic, but again, it's just brought home to me how brilliant our staff are in terms of responding to that. I've got a few words to say by way of introduction before I pass over to colleagues who will talk through their areas of responsibility, and I'll come back at the end and talk about what we've done since this year and a little bit more about our response to COVID. So like any NHS organisation, we underpin our activity by a vision, a mission, and also our values. And it's worth just at this point just reminding ourselves of these so that we can just put everything else in that context. So our vision is to be an outstanding trust delivering excellent healthcare at home, in the community and in hospital. And the mission that follows from that is to improve the health and well-being of the population we serve, building a healthier future together. The Trust has three values within the wider set of NHS values, which are ambitious, caring and together. And I think those three words do symbolise how our staff feel about the services they need to deliver. And we're increasingly trying to make sure that as we work day to day in the organisation, that we do reference how we make decisions and how we judge our own behaviour against those standards. We have 5 strategic objectives, which are on the slide, and I won't talk through them in detail, but we've structured most of this presentation today around these themes, and so it's just worth going through the structure a little bit for you. So we start with patients, because that's what we're here for, and we do our best to provide excellence in healthcare. That's our ambition, and that keeps us striving forwards to do better. Colleagues is a second theme, because actually you can't have excellent healthcare without excellent colleagues. And it's really important that our colleagues are engaged and they understand their role in delivering that, and that they're accountable for their actions, as are we all. For the organisation to do that safely, you have to have good systems of governance. And so, again, we're going to talk about that later in the presentation. Finance is very important. We're a healthcare organisation, not a bank, but we're spending taxpayers' money, and so we need to do that responsibly within the budget available to us, and to make sure that we deliver value for money for local people. And the last one of our strategic objectives is partners. So increasingly, the NHS is about partnership and integration of healthcare, and I've been really pleased to develop new relationships with partners in Rotherham, whether that's the CCG, the GP Federation, the Council, police, and so on and so forth. There is a great approach to partnership in Rotherham, and I'm very pleased to work with those new colleagues. So some of the key points for the 2019-20 year, which of course is now about 6 or 7 months ago, and it feels slightly strange talking about a year when we've had so much change since then with COVID, but I think it is important to stop and reflect and see what we can learn from that year and how that influences what we do in the future. So high quality care is our overriding drive, and my colleagues Angela and Callum will talk about that shortly. I've talked about the importance of our people and what we've had in the last year and in this year so far. We have had a few changes at senior level in the organisation. I've joined the organisation. Michael Wright has joined as interim Deputy Chief Executive, and there are others too. What we've also done recently is developed a people plan that will really drive the board's strategy in terms of how we make Rotherham Hospital and Rotherham Community Services a great place to work in the NHS and pursue your career. And as part of that, we have had our annual Proud Awards ceremony last year. We're looking this year at how we can do that in a virtual way because of COVID, of course, and we're shortly going to introduce some monthly awards for staff as well. Performance is very, very important to an NHS organisation. Last year, our performance was mixed. George Briggs and Steve Hackett will talk through that for us later. I think there are real areas of strength in Rotherham. Diagnostic testing has been something the Trust has been fantastic at for a long time, and trying to get timely delivery of planned care, which is measured in the 18-week referral to treatment target, again has been a real strength for Rotherham, albeit it got a little bit more difficult towards the end of last year. I think what's been more difficult for the Trust is the timeliness of A&E care to the Urgent Emergency Care Centre, but during this year we were one of 14 pilot sites nationally to try a new way of assessing that, and I think we can say that we've made some real progress on that in the last 6 or 7 months. Mortality rates are important for an NHS Trust. They don't tell you everything about an organisation, but we have done a lot of work to make sure that we learn from every death that happens in the organisation as part of the national plan, and we have been looking at how we can make sure we count and measure our mortality as accurately as possible so we know where that is. And again, Callum Gardner, the medical director, will pick some of it up later in the presentation. We're about 3 years into a 5-year strategy, and later this year we're going to renew that, and I think given the way the NHS changed with COVID, I think that's a timely approach to take. Last winter was a real challenge for the organisation. As with much of the NHS, activity went up. Our numbers of beds were stressed and our waiting times went up. I think we recovered really well from that as the COVID pandemic started to hit in February and March. But there are lessons to learn there, and we are taking those into this next year's winter to try and make sure that we implement those changes. And then, of course, not long after I joined the organisation, the new virus that was spreading across the world really hit us, and we've had 6 months that's been really dominated by COVID. As I've said already, the Trust has been magnificent in responding to that. The staff have been brilliant, but the first response to that was really in March of this year. And finances were picked up later by Steve Hackett. It's been a difficult year for the Trust in financial terms. Our final accounts say that we had a balanced budget, but I think there was a number of issues that we could learn from in that, and there were some deteriorations in the finances towards the end of the year that we've since taken action on to address. So at this point, we're going to play a short video highlighting a case study from our maternity services, and following this video, Angela Wood, who's our chief nurse, will pick up the theme around patient care. Thank you.
Hello everybody, my name is Sarah Petty and I was appointed as the Head of Midwifery and Nursing for maternity, gynecology and integrated sexual health. We've got a lot of work that we're doing regarding our continuity of carer, and I have to say that Rotherham have done really well with that over the past 18 months and achieved the trajectory that was 35%. But we have got more work to do, and for me what's really, really important is that we look at getting involved with our harder to reach communities, and that's our next plan, that we will be working at achieving the continuity of care from the ladies that are in those communities, so from the BAME communities, which is the Black, Asian, minority ethnicity groups.
A continuity of carer team is a small team of midwives, no more than 8 midwives, that midwife actually follows the mother through pregnancy, in labour and in the postnatal period, so that they've got a continuity of carer from a lead midwife within the team or her buddy. In Rotherham, we've set up 3 continuity of carer teams.
In January of this year, I was nominated by our head of midwifery at that time and then accepted onto the National Midwifery Ambassador Programme. The Ambassador Programme is an NHS England scheme that's part of the key ambitions from our Chief Midwifery Officer, Jackie Dunkley-Bent. There's 3 parts to the role. The main part is raising positive perceptions of midwifery.
Service improvements and innovations that have just come and we've just implemented that we want to keep. So that's really important that we get those sustained and embedded as they are, because there's some really good practices like we've introduced an e-midwife, Olive, we've introduced blood pressure monitoring, home blood pressure monitoring for women, and we're doing a lot of virtual appointments. So I think it's really important that we really engage with those new ways of working and really keep the ones that really get us working more effectively and efficiently.
What we found with the Willow team, that they've increased our home birth rate within the Trust, and I think it was because the women have had confidence in that team of midwives. They still appreciate it, even though they've moved on to the pathway at 28 weeks, that they've had the rest of their pregnancy with someone that they know, and the postnatal and the intrapartum labour.
So in 2019, we found out that we'd been shortlisted for the National RCM Awards, which is the Royal College of Midwifery. The nomination came from our regional officer, Lynn Galvin, who at the time was just blown away by all the positive changes that were happening within Rotherham Midwifery. We were printed in the RCM National Magazine, and we were really supported, and a lot of people were really impressed with Rotherham being at that level of recognition and the work that's been going on here. The Princess Royal is the patron of the RCM, the Royal College of Midwives, our union, and we were nominated for a royal visit from the Princess Anne. Very exciting, a massive honour, particularly because it got the chance for everybody working in maternity to showcase all the work that we'd been done. She was so genuinely interested, spent time talking to all the patients that we had on the ward that day, as well as all the staff that was here.
Last time, so fantastic hospital, fantastic team. Good. Really good. And they're all fantastic. Last time I had an amazing delivery here as well. I'm not just saying that for your own benefit. They are they're a credit to our
You should have been in and out by now.
We're
not planning to be here today.
No.
And then one of the midwives' daughters came in as well and had the honour of presenting it with some flowers, which was a really special moment for everybody.
Hello, my name's Angela Wood and I'm the Chief Nurse at the Rotherham NHS Foundation Trust. I wanted to talk to you this evening about patients across the Trust and the work that we've been undertaking to make sure they get the best quality care in the organisation all the time. Looking at patients means delivering high quality care to our patients every day, putting patients at the centre of what we do, continuously improving the quality of care and services we provide, and developing and implementing new models of care for the future. All this work's undertaken on a daily basis by teams across the organisation to make sure the patients get the best possible care they can while they're in the hospital, in the community and in their own homes. During 2019 and 20, there's been a lot of work undertaken to ensure that this is happening regularly and consistently and that the quality of care is the best we can possibly make it. Some of the initiatives we've undertaken have been around our safe and sound care. So a quality improvement strategy was written and was launched in April 2019, identifying a framework where we would make sure there was a consistent approach to our care and looking at how we would listen to our patients and our staff and make sure that safety was pertinent in everything that we did. We launched the strategy and we had some really interesting launch events with our teams who really embraced the concept of safe and sound, and it's very evident across the whole of the organisation with staff wearing badges, with posters and with initiatives being badged as safe and sound that it's been accepted and welcomed by the teams. Part of Safe and Sound was to open up and make sure that we had some listening events and opportunities for staff to talk to us. So we regularly have Chief Nurse and Medical Director drop-ins. Since COVID, we've actually done them more virtually and allow staff to come and talk to us via email or Teams. We've put some initiatives in place where the teams have looked at quality improvements and we've undertaken pilots around mouth care and hydration on the wards to make sure we're having the very, very best services and we've got that information to be able to spread across the organisation and have that consistent approach. Harm-free care is something that we've been looking at as part of Safe and Sound to make sure our patients don't undertake any harm while they're with us. And we're looking at making sure that our target of 95% nationally has been met. We're just below the target this time at 93.8% for the year, but we had some consistent months where we were achieving and we've had action plans in place to make sure we do going forward. We've delivered strong infection control and prevention across the organisation. This is a key strength of the organisation. We've been complemented from that point of view. Although our C. diff figures were higher than the trajectory had actually been set, it was identified that we had very, very minimal lapses of care. So everything we had undertaken was appropriate and the Clostridium difficile had occurred anyway. We also unfortunately had one MRSA case in the year against a trajectory of 0. Again, that was reviewed comprehensively by ourselves and our clinical commissioning colleagues, and it was identified there were no lapses in care in that treatment of that patient and the support they were given. Looking at patient experience and how we take things forward is obviously really, really important to us. And we have a patient experience team that works to look at any concerns or any complaints that come in and make sure that we have appropriate and comprehensive responses. And we learn from those to make sure we can change things in the future and that they don't happen again. We have a friends and family test that we'll have undertaken for the last few years. That is actually being revised when it's relaunched after COVID, but we've had consistent feedback and some good response rates across the organisation with response rates of over 95% consistently. We launched a patient experience and engagement strategy through the year, and we appointed a lead to enable us to do more engagement and more community involvement in the future. Since that appointment, we've been working on COVID to make sure patient experience has been captured and patients have been supported to communicate with families, and the lead has been concentrating on that. We will now be taking forward her substantive role and how we can roll that out. Community teams have seen massive increases in activity with an extra 6,000 contacts through the year. We've been concentrating on care closer to home, and our 0 to 19 service has been expanded and developed to ensure that we've got a comprehensive service across all sectors: school nursing, health visitors, etc. The teams have worked fantastically through the year and into the COVID section, looking at how they've adapted and worked together to make sure they've still provided care closer to home, to make sure the patients are supported and they've been able to get the best possible care available. Looked after children is an area particularly that we focused on over the last 12 months. Nationally, it's identified as being challenging, with the targets of 20 days to see the child after they have been taken into care. We have worked to make sure that we're giving the best care to these children, and we are providing that opportunity for them to be attended and looked at within that time period. Anything out of that we identify is either a last-minute cancellation due to unforeseen circumstances, and we report it on a regular basis through commissioners and to the board. We expanded the team last year, and we are getting really positive feedback from the children and young people we are supporting, from social workers and from foster carers and parents that we are helping to make sure that they are giving the best quality care. Quality priorities are another area that we've been looking at throughout the year, looking at how we can make sure we have priorities around patient safety, experience and clinical effectiveness. Those included areas such as medication safety, end-of-life recognition, and improving the experience of patients transitioning from child to adult services. So the 9 quality priorities set at the beginning of financial year, 4 were delivered as planned, such as increased medication safety, improving the experience of patients transitioning, improving mortality reviews, and improving the policy and National Institute of Health and Clinical Excellence guidance, which is the NICE guidance. Of the remaining 5, we have some outstanding areas, but these required actions will continue to be implemented, and we will ensure we have updates in the next year's quality account. Finally, I want to talk to you about CQC. So during 2018, we had an inspection which identified across the organisation we were required improvement, although 46 out of the 64 ratings were actually identified as good, and UECC was identified as inadequate. The teams and the organisation have worked really closely with partners and with the patients and feedback from organisations around the care we've been delivering, and an action plan was put into place. Support was given across the organisation to UECC to try and make sure that we could improve the rating and improve the care within there. In August 19, the CQC came back to do another inspection of just UECC, and it was really pleasing to see that they gave us very positive feedback, recognised improvement, and identified that we were now requires improvement in UECC in line with the rest of the trust, but with good for caring, which was very, very positive outcome for us to turn it around within such a short time frame. And we are still continuing to work and put the implementation of all the actions from the 2018 in place to ensure future CQC inspections will give us an opportunity to provide updates and assurance around our progress.
Good evening. I'm Dr. Callum Gardner and the Medical Director at the Trust. Last year was a very, very busy year for the Trust, and tonight I'm going to talk about 6 areas of improvements that we've made throughout the Trust. One is on patient safety, the other outcomes. I'm going to talk about stroke, mortality, our electronic prescribing and medicines administration or EPMA system, and research and development. Within patient safety, the patient safety team has been enhanced, including the appointment of a new Trust Associate Medical Director for patient safety, which has allowed increased focus on driving improvements in patient safety and quality of care. Several patient safety learning events were held by the divisions last financial year in order to share learning widely across the Trust. In terms of outcomes, the Trust continues to perform well above the national average for the hip fracture best practice tariff at around 90%, which is one of the top performing in the country. Within the best practice tariff, we consistently operate within the 36-hour target, which is 90% compared to the national 68% average. Within stroke, we moved to a regional hyperacute stroke unit model in July of last year. We now have 2 substantive full-time stroke consultants, which has provided consistency of patient care and strong leadership on the stroke unit. Rotherham Stroke Rehabilitation Team have continued to provide therapy to stroke survivors on the stroke unit in Rotherham Hospital and also in the community. We've maintained excellent SNAP scores, averaging between A and B for all therapies, which is how our performance is benchmarked nationally compared to peers. For mortality, the Hospital Standardised Mortality Ratios, or HSMR, and Summary Hospital Level Mortality Indicator, or SHMI, both unfortunately remain high. HSMRs adjust death data, referred to as mortality data, to take into account some of the factors known to affect the underlying risk of death. SHMI is the ratio between the actual number of patients who die following hospitalisation at a trust and the number that would be expected to die on the basis of average England figures. So what are we doing to address this? Well, the Trust introduced the Medical Examiner Service last financial year. This is an independent doctor working with colleagues to highlight areas where further scrutiny is required, to quickly alert the serious incident panel if cases need escalating, to ensure appropriate referral to the coroner, and to converse with families about the care given to their loved ones in order to trigger further quality improvement work where required. The Trust's mortality review policy has been amended in line with national guidance, and the Trust now uses a 2-stage mortality review process. All Stage 1 or First Stage reviews are now undertaken by the Medical Examiner. Those that are flagged as requiring a more in-depth structured judgment review, or SJR, otherwise known as a Stage 2 review, are then undertaken within the divisions. Throughout the last financial year and ongoing, the Trust has continued to focus on improving the quality of care it provides, particularly around themes identified as areas for improvement during mortality reviews, particularly around nutrition, fluid balance and end-of-life care. EPMA. The Trust went live with electronic prescribing and medicines administration, otherwise known as EPMA, across all inpatient areas except critical care on the 18th of September 2019. All outpatients then went live before the end of the financial year in March of this year. This led to a significant improvement in the number of medications omitted, from 7.68% pre-EPMA to 4.95% post-EPMA implementation, with 5% or less being seen as a national benchmark. Research and development. The Trust has had significant success around research and development, with 858 participants recruited into 29 research studies. The Trust has also sponsored local studies in areas such as speech and language therapy, who trialled video conferencing, delivered voice therapy compared to face-to-face, with great patient feedback. A further local study focused on the health and well-being of staff, called Mindful Compassion. Thank you.
Hi, I'm George Briggs. I'm the Chief Operating Officer here at Rotherham Foundation Trust. I'm going to talk to you about how we've cared for our patients and the results that we've had from various standards that we meet or don't meet throughout the period of the year we're talking about. The first standard that I want to talk about is our urgent and emergency care standard. We are part of a national pilot looking at a different way of managing our patient flow through our A&E department. And flow onto our wards. We've been a part of this pilot now for almost a year, and clearly during the COVID pandemic that pilot has continued, but we've not continued to monitor like we had been previously. The national team are now picking up with us how we start to manage. There are three clear standards that they want us to manage to, and we manage to 4. The first one we manage to is time for initial assessment. The average time in last year was 16 minutes and the target is 15 minutes. The next standard was time to see a clinician, and last year's average was 102 minutes and the target is 60 minutes. And the meantime in the department, the target is 200 minutes and we're at 221 minutes. Now, clearly, we're really close to the initial assessment. We're quite away from time in the department and time to see a clinician. During the latter part of the year, i.e. February and March, the standards had improved considerably. and we have been hitting those 3 standards for the last 6 months. But during last year, we had a real difficult period of time to manage those. The other standard that we monitor ourselves against is 12 hours in the department. And there are a number of other standards, but they're the key ones that we manage. We have had a considerable number of people that have waited for 12 hours in our A&E department, waiting for a bed and waiting for care and treatment that we should give. We've had a particularly difficult year in the department, and we have had more people waiting than any of us would have wanted, which has prompted a change in the way we work and the way we manage. Again, we've seen a marked improvement in the last 6 months, but during last year, we did not meet the standards that we were set nationally and we set ourselves. The other key standard that I want to talk about is 18 weeks, and that's the time it takes from a GP referral to our team seeing a patient and agreeing some treatment, either operation or other. The national target is 92%, and we hit 91.6%. We had been above 92% most of the year, but the last 2 months we were just below that. We were still within the top 5 trusts, or top quarter of trusts nationally, so we are, again, although we were below the target for the first time in a number of years, we were still doing very well compared to the rest of the trust nationally. The next target that we monitor ourselves against quite severely is the diagnostic target, which is that anybody that needs a diagnostic treatment or care will be treated, seen, diagnosed within 6 weeks. And again, we're in the top 5 trusts nationally, and 99.3% of our patients waited less than 6 weeks, and the target is 99%. And we've managed to maintain this target now for the last 3 years. Within the national targets around cancer, we hit 3 out of 5 of the national standards, and the key message that we had from last year was that we reduced the people waiting for care and support through a period of cancer from around 1,200 patients to under 700 patients on average throughout the latter part of the year. In Rotherham, we had 2,468 babies born that we helped support the childbirth of. We had 775,000 contacts in our community services, and 668,000 of these were adults, and 107,000 were under the age of 18. We had a marked response to the COVID pandemic. We started planning this in January last year, or this year, and in February and March we ramped up our activities to make sure we met the national requirements around COVID. We set up command structures, we had daily meetings, we established a clear discharge focus with the Rotherham Borough Council. We separated and agreed to separate COVID and non-COVID areas across the trust, from our A&E department through to our wards and discharge areas. We set up staff support lines, swabbing and testing with our drive-through service at Woodside, and TRFT were one of the first services nationally to set up this drive-through service, and that drive-through still functions today. Thank you.
Hello, my name is Stephen Ned. I'm Director of Workforce here at Rotherham NHS Foundation Trust. The Rotherham NHS Foundation Trust recognises that having a stable, flexible and highly skilled workforce with a broad range of skills across the differing professions is key to delivering our ambition to be an outstanding trust, delivering excellent care at home, in our community and in hospital. It follows therefore that having the right workforce with the right skills in the right place is one of the key risks to the organisation delivering its objectives. In keeping with much of the NHS, the Trust has a number of vacancies across a range of disciplines, particularly medical and nursing roles. This impacts on the ability to deliver high quality care and also impacts on the finances of the Trust. The Trust has high temporary staffing costs, both agency and bank, and a key priority for the coming year is to reduce our spending in this area. We have already committed to working with external partners, such as NHS professionals, to help deliver more robust temporary staffing solutions at an affordable cost. We will also be working with other partners in our local integrated care system to increase the supply of staff to fill vacancies on a permanent basis. This includes increasing the number of nursing placements and continuing to develop new roles such as trainee nursing associates and advanced clinical practitioners. We will also develop and expand the use of apprenticeships in the organisation. Another key workforce risk for the Trust relates to ensuring that we work to improve colleague experience at the Trust. It is clear that we have a committed and loyal workforce, but it is also clear from our staff survey results that there are areas where a colleague experience could be better. Over the coming year, we will be focusing on ensuring that there are improvements in colleague experience, as there is strong evidence linking positive colleague experience to better patient outcomes, and we are determined to make improvements in this area. To support colleagues and improve our people offer, the Trust has listened to colleagues during the year and taken into consideration their feedback in developing a people strategy. The people strategy outlines the key priorities for the next 3 years, spanning from 2020 to 2023, and centres around 4 key themes. Those themes are build. How will we build our workforce? Engage. How will we engage with all of our people? Lead. How will we develop our leadership culture and nurture talent? And finally, learn. How will we ensure that there are learning opportunities for all of our staff? The aim is to create a workforce that supports and sustains the delivery of high-quality care and services, combined with the ambition to be in the top 20% of NHS employers nationally for staff experience by 2023, as measured by the National Staff Survey and our own local pulse surveys. The Trust People Strategy has been developed and will be approved by the Board of Directors during Q1 of 2020-2021.
Hi, I'm Michael Wright, the Interim Deputy Chief Executive at the Trust. I started at the Trust in February this year. Today I'm going to be covering governance and partnerships. Our strategy was very clear around governance. We have an effective performance framework to deliver outstanding results. We need to be an outstanding on the CQC well-led framework across the Trust, have high quality data to provide robust information and support decision making, ensure all teams have regular reviews and updates around key issues and opportunities to learn. In terms of what we delivered in 1920, whilst we didn't have a CQC well-led inspection, we did deliver a series of actions to improve how well we are actually led. We focused on data quality during 1920 and recently improved our integrated performance report. We've had a major focus on data quality assurance statements that have given us assurance that our quality is exceptionally robust. We achieved 95% compliance with our IG compliance training. We had numerous internal and external audit reviews undertaken during the year, and we had an improved Head of Internal Audit opinion rating compared to the previous year. We continued performance management across the Trust, challenging areas where performance was less positive than in others. We've more recently updated our performance management framework.
Hello everybody, I'm Steve Hackett, Interim Director of Finance here at the Trust. It's my pleasure to present the outcomes of the annual report in terms of the accounts for last financial year. Before I start though, I'd just like to say a really big thank you to all the budget managers and budget holders within the organisation that have allowed the organisation to deliver the financial position that it did for last financial year. It's impossible for the organisation to be run financially by the Director of Finance. We need to have a delegated structure in place where we trust individuals to manage the finances of the organisation in the most efficient and safe and effective way possible. So it's my pleasure to say that we did deliver a break-even position for the organisation for last financial year 2019-20. However, we did have a problem in terms of increased expenditure in the last quarter of the financial year, so between January 2020 and March 2020. This resulted in a significant overspend against mainly pay budgets in the area, and so we overspent against our allocations by around about £5 million. However, we were able to return a balanced position for the organisation in the totality of the financial year, because as part of our partners across the South Yorkshire and Bassetlaw integrated care system, we were able to draw on external resources which covered that £5,000 deficit, £5 million deficit in the financial year. So overall, the position for the organisation was really strong. We finished on a balanced position, but that was only because we received an additional £5 million worth of income from being part of a wider system across South Yorkshire and Bassetlaw. In terms of the next financial year, we have seen increasing pressure around the COVID expenditure, and we face some difficult choices and some difficult issues to face around financial management going forward into the latter part of the current financial year that we're in. We're still under negotiation with our partners across the South Yorkshire and Bassetlaw ICS footprint as to how that will play out. But we'll learn more about that in the coming weeks and months. But for now, it's my responsibility just to say that we did balance our position for the 2019-20 financial year, but that was only after receiving £5 million worth of additional support from other areas within the ICS. So all I would like to say is just, again, a massive thank you to colleagues in the organisation who helped to deliver that position. And I look forward to working with you more in the future along the coming months. Thank you.
In terms of partners, it's been critical that we work closely with our partners, providing sustainable healthcare and services for the population of Rotherham, opening up to new ideas and innovations, and continue to collaborate with partners across the South Yorkshire and Bassetlaw system. In terms of what we actually delivered during the year, there are a number of benefits and positives. Following a public consultation, we implemented a new network approach to stroke services. We worked with RMBC colleagues to implement intermediate care and reablement pathways with a focus on home care first. Also, along with our South Yorkshire and Bassetlaw partners, we agreed to implement the QUIT programme, a radical approach to support people in quitting smoking. But more importantly, we work collaboratively with partners across both the Rotherham Place and the wider South Yorkshire and Bassetlaw system in our response to COVID. So we know COVID hit the region in early March to mid-March. We worked jointly. We had gold commands on a weekly basis. We made sure we had economies of scale in our purchasing of PPE, and we worked closely to support each other. And that was really beneficial for us as a health system locally. Thank you.
Good evening, everyone, and thank you for inviting me to present our findings from the 2020 audit of the Rotherham NHS Foundation Trust. By way of introduction, my name's Tom Monkhouse, and I was your audit manager for the process. I'll start by sending apologies on behalf of John Minards, who led the audit and signed the annual report this year. John retired from the firm in June and is unfortunately unable to join the meeting today. To start with, a quick reminder in our approach to the audit. We perform our audit in accordance with the International Standards on Auditing UK and the Controller and Auditor General's Code of Audit Practice issued in April 2015. Our reports and audit letters are prepared in accordance with the ISAs UK and the Code and all associated audit guidance notes issued by the National Audit Office together with relevant requirements of the NHS Act 2006. We presented our audit plan to the Audit Committee prior to signing the annual report in June, which included our initial risk assessment and planned approach. As a result of COVID-19, our year-end audit was performed remotely. We completed our audit work and issued an unqualified audit opinion on the financial statements. However, we included a material uncertainty relating to going concern in our report in order to highlight the future uncertainties surrounding the Trust's financial position. We completed our work on value for money and issued a modified adverse opinion due to matters related to the Trust's financial performance and the enforcement undertakings in relation to financial planning. In accordance with instructions received from NHS Improvement dated 23rd March 2020, you did not require any assurance services in relation to your quality report for the year ending 31st March 2020, and accordingly we halted our work upon receipt of these instructions. And finally, we would like to thank NHS Rotherham for their cooperation throughout the audit process in what are unprecedented times. Thank you and enjoy the rest of your evening.
Hello everyone. As Lead Governor, it is my privilege to respond briefly on behalf of the Council of Governors to the annual report for 2019-2020. I've picked out a couple of the key moments from the year to highlight for you. The Trust continues to face some challenges, as you've heard, not least from the menace of COVID-19. However, the Council believes that we have the right leadership and the right teams in place to ensure that we navigate the next year as well as we can. The Council noted that in August of 2019, the Trust received another unannounced inspection from the Care Quality Commission. Although, overall, the status of the Trust remained at requires improvement, the Council was buoyed by the fact that a number of parameters measured by the CQC had improved. The Council were especially pleased that the rating for the Urgent and Emergency Care Centre was raised to requires improvement. The Governors are aware that the quality of care for patients is very high on the agenda of the Board of Directors and are confident that all necessary steps will be taken in this regard, with particular emphasis this year on improvements in diagnostic testing and a reduction in the mortality rate. As you've heard, the financial landscape for the NHS in general, and Rotherham Foundation Trust in particular, is challenging. After reclaiming a firmer footing during 2018-19, the Council was confident that the direction of travel would remain steady for the Trust's finances. Unfortunately, as you know, this was not the case, and the Governors were disappointed at the year-end financial situation. Strong leadership and a real emphasis on fully investigating the issues has led to the Council being more assured that the financial management of the Trust is more secure this year, COVID-19 notwithstanding. It is a situation that the Governors will continue to monitor closely throughout the year. During the year, we said goodbye to our former Chief Executive Louise Barnett and non-executive director colleagues Barry Mellor and Dr David Hanna, and we thank them all for their service to the Trust. The Council of Governors interviewed and appointed two new, and I think it is fair to say excellent, non-executive directors in the shape of Nicola Bancroft and Dr Rumit Shah. They've already settled in well to their roles, and that includes chairing two of the important monthly assurance committees. The Council also approved the appointment of Dr Richard Jenkins as Chief Executive Officer of the Trust, and we welcome the appointment of Michael Wright as his deputy. These appointments have all been very positive for the Trust so far, and we look forward to working with these colleagues next year. The public governors have an important role in representing the public voice and the diversity of the local community, and also in influencing the continual improvement of health services for the people of Rotherham. Therefore, a full Council of Governors means that they can fulfil that role much more effectively. Over the last 2 years, it has proven difficult to elect enough governors to fully achieve this. So, as a Council, working closely with the Trust leadership, the governance team and the communications team, we decided to hold what was an unprecedented mid-term election to attract a new cohort of governors. Partly due to the great work by the team, and partly because of the justified admiration, respect and interest in the NHS caused by the COVID-19 crisis, we've now been able to welcome 8 new public governors to the Council. This means that there are now only 3 vacancies on the Council, and that every constituency of Rotherham has at least 1 governor, which is an excellent result for the public and for the Trust. We wanted to say a big thank you to everyone involved in the process. Finally, I wanted to say that last year was clearly a challenging one for the Trust. This year has proven even more challenging thus far. The COVID crisis has meant that the NHS has had to respond to the biggest threat to the nation's public health since its inception in 1948. So the Council of Governors want to take this opportunity to pay tribute to everyone who works for the Trust and all of the other NHS staff in Rotherham for their dedication and hard work, both before and during this crisis. The NHS relies on its people to operate effectively, and the people in the NHS have not let us down. Thank you all very much. Good evening.
So COVID-19 has taken up a huge amount of our efforts over the last 6 months. The pandemic really hit us in March, and we had a month or two of rising numbers of cases where we were drastically changing how we delivered care to try and cope with what we feared would be an overwhelming number of cases. During that period, our staff were absolutely amazing in terms of how they adapted rapidly to work very differently, despite the anxieties they had individually about the risks of catching COVID themselves and some of the difficulties we had early on with PPE. But we adjusted the internal structure of the hospital, we changed our pathways, and staff coped really, really well. We got through the peak of the epidemic, and we were glad then, obviously, to see the case numbers fall. We eventually got to a position where the number of cases in the hospital had fallen to zero. But clearly, we are now starting to see a rise in activity again, and we are going to be simultaneously thinking about how we recover our activity and catch up with those patients we've sadly kept waiting for routine care whilst we dealt with the pandemic, whilst also having one eye on what's happening with the number of cases coming back. So a few of the things that we did to respond were, for example, within only a few weeks, we opened a new 50-bedded intensive care unit in the hospital so that we had enough capacity for what we feared at the time would be a large number of people needing ventilation. Fortunately, those numbers of patients needing ventilation never materialised as much as that, but the work that staff did to get ready for that was incredible. Throughout the pandemic, our staff have done their best to look after each patient as well as they can, but sadly we have had a number of deaths in Rotherham from COVID, and every one of those deaths is a member of our local community. It's someone who's a member of a family, and sometimes it's possible to lose sight of some of the individual stories and the numbers, but please be assured that our staff have cared about every single person they've looked after, whether they survived or not, and they've done their best under these difficult circumstances to support families with that difficult process. We have had to restrict visiting at times through the pandemic in order to protect staff and patients, and we've been looking recently at how we can relax that again in light of the what we now know about PPE and safe precautions. Staff have been really pleased to see how well their efforts have been recognised by the local communities, and certainly when there was a weekly clap for carers, that was a massive morale boost for our staff, and the NHS Rainbow Badge initiative as well has been really positive, not least when the council and some local businesses painted the Thank You NHS logo on the roads outside the hospital. That was a really nice gesture that our staff appreciated. We're now in the phase of recovery, and so we're trying to get our outpatients and diagnostics and operations back on again. And I hope that we can get as much of that caught up as possible as we also simultaneously prepare for winter and keep one eye on whether or not we're going to get more COVID cases coming through. As well as dealing with COVID, it's important that we try and move the Trust forward in a range of other areas. And I'm going to spend a few minutes just talking through what our forward plans are for the rest of this year. We've agreed a set of 11 objectives and priorities for the organisation, and it's a smaller set of priorities than we would normally have, but I think the view of the board this year was that whilst we're coping with COVID, it's important to have a narrower range of focus and make sure we deliver on those issues. So for this year, we are really focusing on our mortality rates, our operational performance, supporting our staff, and good financial stewardship. We've agreed a range of 7 priorities within that framework. So one of those is around flow through the organisation. That's making sure we've got enough beds and that people aren't kept waiting for a bed when they need to come into hospital. And we're hoping to get the bulk of that work done before winter this year. We also set a priority to transform our outpatient services, and we've made huge strides with that in that regard as we've adapted to COVID. So, for example, the use of video consultations or telephone consultations has been really transformative, and we'll continue in that vein. Thirdly, we want to improve staff engagement and morale. I've mentioned the people plan we've put in place already, but we've put an awful lot of different support packages in place for staff through the pandemic, and we've recently announced to staff an extra day's annual leave to really reflect the thanks that the board wants to express towards our staff for the efforts they put in. And as well as that, we think staff need to take the time away from work to recharge their batteries as well. Fourthly, we want to maximise how effective our leadership is in the organisation, and so that's about making sure we've got the right development processes in for the senior leadership and make sure we've got the right structures in place. Fifth, we want to make sure we recruit the right numbers of staff for the right skills. And we've made a lot of progress that through COVID. We've had new nurses and new doctors join us, and we have a larger workforce now than we did have at the start of the pandemic, but there's more that we can do in that regard. And ultimately, we want to continue to drive forward how we improve our estate. We've made some change to that, so we've moved our women's services to a new lovely building, which I had the pleasure of opening a few weeks ago. And we've also made some changes in how we deliver services in the community. And lastly, we are looking to develop a joint gastroenterology service with our partners at Barnsley Hospital, and that work is going on, and we hope to have progress on that before the end of the year. For finances, I mentioned earlier that there were some challenges at the end of the last financial year. We've put a lot of measures in place since then to have good oversight and grip on how we spend the taxpayers' money, and there's more work to do in that regard, particularly as we also cope with winter and COVID. I mentioned earlier that we're going to be renewing our strategy this year. I think the strategic context in NHS has changed somewhat with the COVID pandemic, and so it does feel the right time that we do a fairly significant set of reflection and refinement about where we need to be leading the organisation to over the next few years. And really, that has to be about getting really strong, sustainable, high-quality care, delivering the operational standards we've been asked to do by the government, and to do that with happy staff and within the budgets that we've been allocated. Those are a complicated set of challenges, but one that the senior leadership team and the board are committed to tackling, and I think there's grounds for optimism with such a strong workforce, and all the ingredients are here in Rotherham for success.
Good evening, ladies and gentlemen. My name is Rumit Shah, and I'm a non-executive director at the Rotherham NHS Foundation Trust. I was appointed by the Council of Governors for a 3-year term of office, and I started on the 1st of January 2020. I'm a member of the Trust's Unitary Board, along with 7 other non-executive directors and 7 executive directors. I am a GP working at Hatfield Health Centre in the east of Doncaster. I was recently appointed as a Primary Care Network Clinical Director for the east of Doncaster. My clinical knowledge has brought to the board an expertise which I hope is useful to the Rotherham NHS Foundation Trust. The Board of Directors currently meets 10 times a year in public, and it's possible for anybody to attend those meetings. Currently, due to COVID-19 restrictions, we have had to conduct these meetings virtually. The board has 3 assurance committees: Quality, People, Finance and Performance, and an Audit Committee. I sit on the Quality Assurance Committee and the Finance and Performance Committee, and I'm delighted to have been recently appointed to be chair of the Quality Committee. As a non-executive director, I have a lead role liaising with the Family Health Division. I am a member of the Trust Resuscitation Committee and Responsible Officer Advisory Group. Our job as a non-executive director and a member of the Unitary Board, my role is to hold the organisation to account to deliver the policies, strategies and annual operational plan. We are accountable on a quarterly basis to the Council of Governors. We're committed to supporting a healthier future for the people of Rotherham and support teams to deliver the very best care.
As a public governor, I'm representing members of the public. But as I say, a lot of positives, because I was involved, the Friends and Family test. I was involved with that for a long time, collating all the information, which gave me an overview of what's happening. And so I'm able to speak to patients and say, this is what I would recommend that you do, or have you thought about this? But yes, I generally find it's a good role to have. I'll be glad when we can get back into the hospital. Governors represent the interests of both members of the Trust and members of the public and ensure that their voice is heard loud and clear within the Trust. Usually I'm able to engage with the public as I spend a great deal of time in the hospital as a volunteer. This gives me the opportunity to listen to and take on board the many and diverse views of patients and visitors. Since COVID-19 came along, I have obviously not had the same opportunity. But through the wonder of technology, we as governors have been fully informed and consulted about the current issues, forthcoming initiatives and planning for the future. It is the role of the Council of Governors, which is made up of public governors, staff governors and partner governors, to hold the non-executive directors individually and collectively to account for the performance of the Board of Directors. To do this, we hold quarterly Council of Governors meetings, which are usually open to members of the public to attend. Throughout the pandemic, we have continued to hold Council of Governors meetings, although these are now held virtually rather than face-to-face. I was delighted to be elected as a public governor, and 16 months into my term, I'm still enjoying the role, and my aim remains the same, to see that both the Trust's hospital-based and community services continue to provide the safest, highest quality care. There may be difficult times ahead, and I look forward to working with all my fellow governors to meet these challenges and to help to support the Rotherham NHS Foundation Trust and continue to represent its service users.
Hi, my name's Chris Bott. I've been a nurse here for 28 years. In the last 15, I've been an advanced nurse practitioner. For the last 4.5 years, I've been the clinical lead advanced practitioner for the hospital night team. Having worked here for so long, you kind of develop friendships and relationships with colleagues, and that's one of the things that led me towards becoming a staff governor, trying to be a representative of the everyday person on the wards. As a senior nurse, they come to you with their sound bites and the complaints and their reassurances as well. It's not all negative, and you like to feed that back up to the powers that be. And I found that I hoped that being a governor would be a forum to do that. So from the top to the bottom, to the bottom to the top, you're kind of a catalyst between the communication of the two. I find that side of it very rewarding. I'm there for the common person and to help alleviate stress around the Trust where I can. I found working with the other governors, staff and non-staff, also with the execs, that you are privy to things that you can share with other members of staff around the Trust, which brings me a great deal of pleasure doing so. Because sometimes I do think there is a gap between the members of staff on the ward and the governors and executive board.
Here at the Trust, we have approximately 125 volunteers. They cover all clinical and non-clinical areas within the Trust, from library services, ward support, pharmacy, the antenatal groups, and Warncliffe. They're on the cancer wards. They cover all aspects. They have enough energy to run a whole power station, if you like. We do have some fabulous characters that have been here for many, many decades. So going through the database, I noticed that we had one volunteer that had done 43 years. 43, she wasn't even an employee, she was a volunteer. She's been a volunteer here. This year is her 44th year. And so, we made a big fuss of this lady, and Martin Havenham presented her with a bouquet of flowers, and, you know, really appreciative of the time and dedication that she'd given. And also the charity as well. The volunteers raise a lot of money for the Trust charities, you know, having bookstores and helping with cake sales, you know, so that's another branch in our tree to be proud of.
Hello, my name is Shafiq. I'm Shafiq Hussain. I'm the Chief Executive of Voluntary Action Rotherham, VAR. We're an umbrella support organisation that works with voluntary and community groups and charities. We've been around around 40 years in total, and our main role is to work with community sector organisations to provide them with a wide range of support services. That might be from setting up an organisation all the way to helping support and expand an organisation. And that includes things like helping organisations to find funding and support, looking at premises issues, supporting with HR, looking at financial viability. I think the biggest thing that the voluntary community sector wants from an infrastructure organisation like ourselves is mostly around information and communication, because there are hundreds of small, medium, large VCS organisations, and they're not all plugged into what's happening in Rotherham. And part of our role is to ensure that actually we provide the information to those organisations on things which are relevant and important to them, so they can make a judgment call in terms of when to be involved in and what to be involved in.
So my name's Kerry McGrath. I work for the Volunteer Centre based at Voluntary Action Rotherham, and my role is to support organisations and charities that need volunteers, help them to manage them, deliver some training, provide good practice support, and I also manage the Volunteer Centre that helps people to find local volunteer opportunities. And the opportunities that we've got in Rotherham are quite wide-ranging. We've got a diverse menu on our website, everything from administration to gardening roles, fundraising and befriending roles, which have been particularly helpful during the pandemic. I think volunteering will play a key role in the future. We've seen at the moment just how important the volunteer roles are during the pandemic, and I think that will continue as we need to respond to the current crisis. We will continue to work with partner organisations in advertising and developing volunteer roles. We've seen over 1,000 people sign up to volunteer in Rotherham just to help with the COVID-19 response. So we're confident that as a community, we can really respond to the need of local people and the ask of the community during the pandemic as well.
Thousands of volunteers have come forward through the Good Sam national campaign for the NHS where volunteers are concerned. Some of those have been utilised by the Trust. We've also had many hundreds of volunteers who have come forward locally through the Rotherham Heroes campaign, the local community hub.
So usually on our website, you can view just under 200 different volunteer opportunities, and they might include sports, marketing, fundraising, administration, anything that you can think of we will probably offer. So we try to work hard to find people a role that suits them, a role that they'll enjoy, that they'll find rewarding. And those roles can be anything from one-off, part-time or even full-time roles, quite a few hours a week. And these organisations that we work with rely heavily on volunteers, so much so that they actually say they might close tomorrow without the support of local people. So we're really fortunate in Rotherham that people do want to give up the time. We have inquiries and applications most days. We handle something over 650 applications every year. And Rotherham people do want to help and they do want to support. So we really do feel like there is something for everyone.